you say that reinvigorating democracy is the first step to improving health in America. And I just would love to have you kind of explicate that very compelling, but yet not altogether clear statement. What do you mean by that?
Yeah, I'm so glad you asked that question because I really do love talking about this. In the process of doing this work, I and my colleagues have had some just real epiphanies. And this was one of them, this notion that democracy is good for your health. It's this idea that robust participatory democracy actually yields more equitable policy outcomes. And if you think about it, you can sort of think about the other state, which is basically marginalized communities. And the history of the United States is such that racism and, sort of our history of first slavery and then basically apartheid with respect to African Americans, but also with respect to other populations who have been marginalized and essentially steered away from resources and opportunities. That history is a history of exclusion. The goal is to essentially keep people away from resources and from power. And at the end of the day, that's how you oppress somebody. You essentially deny them the ability to exercise their naturally, given talents and skills. And so racism was a system of exclusion from opportunity. And the result of that is that you get political decision making in communities that essentially steers resources away from people who are disfavored and disempowered. So simple things like, is there a park in your neighborhood? Well, you can actually assess the likelihood of having a park in your neighborhood based on the demographics of the neighborhoods, in that community, because the system would prefer certain types of populations and invest resources in those populations, in those neighborhoods in which they lived. And because we had such a rigid system of apartheid or racial segregation, it was easy for government to do that. If you're in power, if you're in power, you recognize that some communities just have more ability to get you out of power. So you would essentially try to curry favor with those communities. And disproportionately, those communities were white communities. And the ones that couldn't really do a future were communities of color. So right there, you can see how politics, and this is the other thing we would say, is that health is political, small p political, not partisan. But if you define politics as the struggle over the allocation of limited and precious social goods, like things like a grocery store in your neighborhood, or a park, or a bike lane, or sidewalks, or potable water, or broadband infrastructure. These are health protective resources that, in theory, should be distributed in an equitable manner. And an equitable manner doesn't mean an equal manner, even. It means according to need for those resources. And what we know is that low income communities have a greater need for those kinds of resources than high income communities. And what we see is the inverse. You see these resources disproportionately allocated to high income communities. So that's why we think our democracy is not functioning. It's not producing equitable outcomes because power is skewed across those that have the ability to participate in decision making. And so our work is focused on trying to build a power and a critical mass of people in low income communities so that they can more effectively participate in democracy. And we've seen that when we do that, and when communities have more voice and more power, you see very different decision making at the local community level, at the regional level, and ultimately at the state level as well.
As someone who's worked in community public health internationally and nationally, it's hard and complicated, right? And it's so easy to jump into a mode where you just try to do better. Like, I'm going to do better. I'm not going to be influenced by those things. But I think ultimately that doesn't produce a sustainable result that we all want, because the power dynamics will continue, and eventually the shift will revert back.